Okay, folks, let's talk about pneumonia. Question that confuse you every year. Each year, the same problem about the pneumonia. So I want to clarify some confused, misunderstood questions that we will receive, and you will be asked about that. And let's go. So you start with definition. So what's pneumonia is? So pneumonia, take your pens and papers, my beloveds. So pneumonia is acute inflammation of the lungs caused by infection. Period. So initial diagnosed on clinical findings and sometimes chest X-ray. Initial diagnosis. But you start with clinical findings. Causes, symptoms, treatment, preventive measures, and prognosis after differ depending on whether the infection is bacterial, mycobacterial, you name it, viral, fungal, or a parasitic. Whether it's acquired in the community or hospital, whether it occurs in a patient treated with mechanical ventilation, one of the most dangerous situations, and whether it develops in a patient who is immunocompetent or immunocompromised. Okay? So you start with this. So I repeat it, my beloveds. Doesn't matter what question you've got, what medical exam is this. You always start with definition and try to be more specific. So about the leading cause of death worldwide. Yes, of course, pneumonia. No, of course, it's not coronary artery disease or cancer. But pneumonia is a leading cause of death worldwide. While often thought of it's a treatable infection, pneumonia remains a significant global health challenge. So, for example, it's a leading cause of death in children under 5, no babies, and a major cause of mortality in the elderly. So if the elder patient, aged person, 75 plus, not death due to coronary artery disease or cancer, cause is a pneumonia. So it's a leading cause. So I find this question, epidemiology. Under the 5 is the major cause of death, and 75 plus. This highlights the importance of prevention and early diagnosis and appropriate treatment. So clinical issue of that, it challenges the common perception that pneumonia is a simple illness easily managed with antibiotics. No? Yes. But you have to understand that it challenges the common perception that pneumonia is true and it's a simple illness easily managed with antibiotics. It challenges that. Yeah, of course, this data. Now about bacteria. Of course, while Streptococcus pneumonia is the most common culprit, of course, no question of that, no doubts. But pneumonia can be caused by viruses, my beloveds. Influenza, RCV, adenovirus, then fungi, Pneumocystis jirovecii. Jirovecii, depends how to pronounce it. Aspergillus. No, you pronounce aspergillus maybe. And even parasites. Knowing the potential causative agents is crucial for accurate diagnosis and treatment. So what is clinical issue of that? It broadens the understanding of pneumonia diverse etiology. Of course, bacteria and viruses. Actually, virus and bacteria. No upper respiratory tract infection, then it finished with bacteria in inflammation of the lungs. It's actually pneumonia. Then about aspiration, my beloveds. Aspiration pneumonia can be a very serious and dangerous complication. Aspiration pneumonia occurs when food, saliva, liquids, vomit are inhaled into the lungs. This is a particular risk for individuals with swallowing difficulties, impaired consciousness, or underlying medical conditions. It often requires different management strategies than routine community-acquired pneumonia. Actually, I didn't remark this section, expiration pneumonia, but you might ask about that. So it highlights the clinical issue. It highlights the link between seemingly unrelated conditions and the lungs. Seemingly unrelated conditions. About atypical pneumonia, especially in elderly. Yes, my beloveds. Pneumonia can present atypically, especially in the aged persons. Elderly patients with pneumonia may not present with the classic symptoms of cough, fever, and chest pain. But very aged person, because actually there is no pneumonia without fever. But the elderly exists without cough, fever, and chest pain. Chest pain is a sign of pleuritis. Instead, they may exhibit confusion, weakness, falls, or a decline in functional status. This emphasizes the importance of considering pneumonia in older adults with unexplained symptoms. This is a clinical issue because it demonstrates the variability of pneumonia presentation across different age groups, especially in adults. Now about antibiotic resistance. Actually, I don't like this question, but anyway, it's a growing concern. Why? It's a long history. The increasing prevalence of antibiotic-resistant bacteria is making the treatment of pneumonia more challenging. Judicious antibiotic use and antimicrobial stewardship programs are essential to combat this threat. Clinical issue. It connects pneumonia to the broader issue of antibiotic resistance. But actually, if you start normally with amoxicillin, everything will be great. Then about CURB 65. No, it's actually for future pulmonologists. I don't know, you will be asked about this or not. This is an acronym, CURB 65. This is a score. A score helps. This CURB 65, I repeat its acronym, abbreviation, CURB. CURB 65 score helps assess severity. So the CURB 65 score, now widely used clinical prediction rule to assess the severity of pneumonia and guide decisions about hospitalization, possible hospitalization. It considers confusion, urea, respiratory rate, blood pressure, and age. This helps determine the appropriate level of care for each concrete patient. Precise. So, clinical issue. It demonstrates the use of standardized scoring systems to improve patient outcomes. Pneumonia can lead to serious complications beyond the lungs. Of course, my beloveds. So, if you receive questions like this, my beloveds, you have to understand that in every question there is an answer. I repeat it several times, 1,000 times. If question is correct. No, in the question there is an answer. Pneumonia can lead to serious. Can pneumonia lead to serious complications beyond the lungs? Why primarily, of course, a lung infection, pneumonia can lead to systemic complications, such as sepsis, can be, definitely, acute respiratory distress syndrome, ARDS, might be, emphysema, lung abscess. These complications can significantly increase morbidity and mortality, and they increase. So clinical issue, it illustrates how a localized infection can have widespread effects on the body. Now about so-called walking pneumonia. Actually, walking pneumonia misnomer. The term walking pneumonia often refers to milder form of pneumonia, typically caused by Mycoplasma pneumonia. Typically, not always, of course, but typically. While symptoms might be less severe, it's important to remember that Mycoplasma pneumonia can still cause significant illness and complications in some type of individuals. It should not be dismissed as a trivial infection. So, clinical issue, walking pneumonia, like this, that clarifies a commonly misunderstood term. Then, multiplex PCR is revolutionizing pneumonia diagnostic. So, yes, traditional culture methods can be slow, yes, and multiplex PCR panels, which can detect a wide range of bacteria and viral pathogens from a single respiratory sample within hours, are rapidly become standard of care. Actually, a highly controversial point, but if you receive questions like this, of course you have to answer that multiplex PCR, it's a revolutionizing pneumonia diagnostics method. This has significant implications for antibiotic stewardship and appropriate antiviral therapy. So actually it focuses on a specific clinical importance. It focuses on a specific rapidly advancing diagnostic technologies, emphasizes the practical impact. Here we have, of course, faster results, better treatment decisions. It's also more relevant to current clinical practice. For example, for real clinical practice, highly controversial. About vaccination, actually, my beloveds, you know how difficult this question is on YouTube or on another platform. We know that a complex and increasingly controversial decision, while historically promoted as a clear preventive measure, pneumococcal vaccination now requires more nuanced consideration. Efficacy data now is debated, particularly in certain populations, and concerns regarding potential side effects and are frequently voiced. So, my beloveds, doctors should engage in clinical issue. We have to answer like this. Why not? And you remember in your future medical practice that we should engage in transparent discussions with patients, presenting the available evidence alongside and acknowledgement the existing uncertainties, and promoting a shared decision-making process based on individual risk profiles and values. So the previously clear-cut recommendations are now far less obvious. That is the truth. Now, all questions I clarified that I've received, that I've remarked these several years on your board big state exams. God bless you. Don't forget to follow and subscribe my Dr. Y YouTube channel, as well as don't forget to follow and subscribe my Telegram channel, Dr. Y. It's a private channel in Telegram. So how to find this channel? You tap in searching mode, Dr. Y, W-H-Y. No like question, Dr. Y, it's me, without question mark, of course. In searching mode of Telegram, Dr. Y, W-H-Y. You find this boat, you click start and you choose your plan. It's not costly at all. And you will find question like this. So your MCQ tests, oral exam tests, students cheat sheets, why not, present gifts, yes. So we will talk. So see you on my Telegram channel, Dr. Y. Stay blessed.